It is often said that getting old increases your risk of eye disease, but at this time and age, nothing is inevitable, which is why maintaining good eyesight is essential. Hello and welcome to Let's Talk. My name is Oluwaseun. On Let's Talk this week, we will be discussing eye health and maintaining good eyesight. My guest is Dr. Adebukola Adewumi Oluwaseun, Senior Optometrist, Osun State Specialist Hospital, Nigeria. But before we delve into the program proper, as usual, I would like to remind you to please subscribe to our YouTube channel and follow us on all of our social media platforms. Please stay with us. Thank you so much, Dr. Buki, for coming on the show. It's nice having you here.
Thank you very much. It's nice being here.
So, how important is eyesight or eye health to general well-being?
Eye health, it's very different from eyesight. Many persons feel once their eyesight is good, they are good to go. But it's beyond that. Eye health, it's a complete state of the condition of your eyes. A lot of persons might have good eyesight, but yet their eye health is sick. They are sick in their eye health. Their eye health is not efficient enough, and that in the long run could affect the person's productivity in life, because 80% of what your perspective of life is dependent on your sight. So I would start by making us understand what our eye health actually is. Your eye health is the state of your vision being good, your ocular health being good, and the functional ability of your eyes being maximized. So it's just beyond I can see. That's why you see some persons that could see very well yesterday, and today their eyes are gone because their eyesight was good, but their eye health wasn't good. So it's very important that every one of us, we are concerned about our eye health and not just our eyesight, because that has a good impact on our general well-being in life.
Now, we know that bad eyesight, just like you mentioned, does not only come with age. What are the things that causes damage to the eye?
Bad eyesight doesn't just come with age, and the truth is, if several other things are taken into consideration properly, even though you age, your eye condition could still be kept in a good state. Other things that could destroy the eyes are the kind of diet we take. What are the kind of food you take in? Are you the type that take good fruits? You take fruits that are well washed? Are you the type that take vegetables? These are things that could keep your eye health. But if you are the type that you are just good at taking junks, you take things that doesn't have the necessary vitamins and antioxidants that help your eyes, your diet could also help in deteriorating your eyes. Then your lifestyle could also help your eyes. When I say your lifestyle, what do I mean? If you are the type that smokes, you take alcohol, these things destroy your optic nerve. They destroy the back of your eyes. Yes, everybody see your eyes that they are good, and for some person they may just have red eyes, but something terrible could be happening at the back of your eyes while you are satisfying that pleasure. Then another thing that could also destroy our eyes is our general well-being of our body, our blood sugar, our blood pressure, our cholesterol level. These are things that many of us don't take serious. But how the level of these parameters in our body also have a long way to have something serious to do with our eyes. They have impact on our eyes. If your sugar level goes so high and you are not managing it properly, it begins to affect your blood vessels inside your eyes. And with time, that could cause retinopathy. And over time, that person might lose his or her eyes. you should be able to, if you are the type that wants a very good eye health, you want your eyes to be maintained to a very good age, you should be able to regulate your weights. Be the type that do exercise. You should get yourself, not be monitor your BMI. Don't let your body mass index skyrocket, go beyond normal. When this happens, they could also affect your eye health. Then another thing that could also destroy the eye is the way we use medications on our eyes. Some persons just believe eye drops are eye drops. Every eye drop, they are all the same. No, eye drops are just like medications, like these tablets we take. They all have various things they do to the eyes. So you shouldn't, when you take medications from friends, you walk into the pharmacy and get medications because you feel you used a particular medication last week or last month and you feel it worked for you, and you just walk into the pharmacy and get an eye drop, it could be deteriorating the condition of your eyes instead of helping you while you feel you are getting relief. So these things are things we must take note of if we want to keep our eye health in excellent condition.
I think I'm a culprit of having to say, oh, this was the medication that was given to me to use. I remember many years ago when my eye was really, really, really giving me a whole lot of trouble and all. So there was this ice drop that was prescribed for me, that's Vicin, and after how many years I started having pain again, so I started to look for Vicin. Unfortunately, so because that was what I was using, that was what was given to me. So I think with what you just said, it is essential that we know that just as we take serious our health, we should also look into our eye too, which brings me to the point that I would want us to actually explain deeper on eye hygiene and how we can improve our eyesight.
Eye
Yes.
hygiene, it's just like it's the way you take care of your body. The same attention you give to your body, you should give to your eyes. If possible, you should even give your eyes more. The reason I say this is the eyes, they are so delicate because any damage that happens to them, the best you can do for yourself is take care of this gift God has given to you. You know, if you want to keep a good hygiene for your eyes, the very first thing you should be careful about is you don't touch your eyes at every point you feel like touching it. Especially this dry, when the wind is dry, there's this condition that usually follows dry wind, dry conditions of the weather. Allergies in the eye, allergies in the throat. You see, your throat just become itchy, your eyes become itchy. It's wrong for you to begin to touch the eyes. You want to rub, you are tempted to rub. It's better for you to, instead of rubbing, just dab the eyes. Dab the eyes, just touch lightly and stop. And that is when your hands are clean. Before you do that, you sanitize your hands, because your hands, there might already be organisms on your hands. And when you take them straight to your eyes, you are complicating the issue. Maybe some organisms too they are clogged around your eyelashes, and it's giving you the sensation of itchy. You take the hands that are also already having clogs of these organisms and you place it on the eye, so you are complicating the issue. So it's always very safe to make sure your hands are clean before they get to your eyes. That's one, in maintaining good hygiene for your eyes. Then another thing is, don't wear materials that are for other persons on your eyes. Let me use this good example. We ladies, many of us like to put on contacts. Even though contacts are, we advise contacts for some persons professionally. Some ladies they just want to put on contacts to look good. Cosmetically, they just want to have contact lenses on their eyes. It's dangerous for you to wear contacts without following the instructions. That's why before you get a contact lens, there are instructions, guidelines on your contacts. Don't also get contacts from these roadside persons, cosmeticians that are not licensed to give you contacts, because many of them they don't know the rudiments to putting on contacts. Even these eyewears we wear, our mascaras, our eyeliners, those things, we must make sure they are always clean before we have them on our eyes. Because while you are applying that eyeliner on your eye, you might just be applying microorganisms on your eyes, which would later on cause infections, conjunctivitis, and all that. So it's good that your eyewear, as a lady, your eyewear must always be kept clean. When they are used, make sure the pencils or the brushes, they are cleaned before you keep. They are cleaned and they are dry. In that way, you can have your eyes guided from microorganisms that could end up causing infections. The another thing you could do to keep your eye clean, to give good hygiene to your face, is your towels. Try not to share towels, face towels with people. Some persons are, once they are feeling hot or something, they just get someone else's hand towels. It could be dangerous because there are some infections of the eyes that are contagious. When you take someone else's hand towel or face towel and use it on your face, you could also share in the person's eye infection. So these are some things we could do to keep our eye hygiene. It's very important, very, very important.
Okay. Now, what is the health implication of artificial eyelashes? There's a glue, there's different things. What is the health implication?
Artificial eyelashes. Artificial eyelashes could be very dangerous. One, because in the bid of attaching the artificial eyelashes to your eyes, the glue could get into your eyes. And once that happens, that could infect your eyes, that could damage the cornea. That's one danger to it. Then another thing that could happen is, when you fix these artificial lashes, thank God for science. Science is improving as we are growing. There are these recent eyelashes that are made, that are things you can just, once you use, you don't keep. Once you take it off, they are disposable, and you don't need that glue they usually use on the eye. So they have a safe glue that comes with them, and they are disposable. I think that is better. I usually advise for those persons that, I must use eyelashes when I'm going for functions. Okay, please make sure you look for these ones, because these other ones that your cosmetician helps you glue to your eyes, it has more harm than good. So, and for those that could avoid it, I advise just avoid it. Just avoid eyelashes as much as you can, because artificial eyelashes, they are longer than our natural eyelashes. And eyelashes being there, what they do is they save the eye from danger, as it were. They sieve unnecessary things from entering the eyes. if you look at the lashes on our lashes, they are not like our are thinner, and they flap faster than those artificial eyelashes. So it's like when you have an artificial eyelash on your eye, it's like you are reducing the way your eyelids are supposed to work, the speed at which they are supposed to work, because you have added weight to them. And over time, there's a possibility that materials that shouldn't have gone into your eyes could go in. So for me, it has more harm than good. Artificial eyelashes are things we should avoid as much as we can to prevent infections to our eyes. It's better we avoid them.
Okay, now let's quickly go on this break. We'll be right back. So, welcome back. The program is Let's Talk, and I've been discussing with Dr. Adebukola Oluwaseun, Senior Optometrist, Osun State Specialist Hospital, Nigeria. And we'll be talking about eye health and maintaining good hygiene too when it comes to eyesight. So, Doctor, before we went on that break, thank you for standing by.
Thank you.
Yeah, before we went on that break, we were still talking about the implication of health implication of eyelashes on our eye. Now, how if you've said it all, and it's very necessary that we take that into cognizance on knowing the level of fashion we want to do as regards our eye. How then do we maintain good eye hygiene? Give us tips. What are the things we should do to ensure that we have this good eyesight? And I also want you to put into consideration other things that we do beyond what we've just mentioned, like staying in front of the TV, spending time with your iPad or laptop, all of these gadgets and all.
Maintain the tips. I'll just give some tips. I'll mention some things we should do. First, I would mention is we must make sure we do comprehensive dilated eye exams at least once in a year. Make sure you see an eye doctor at least once in a year. Your eyes doesn't have to give you issues before you go and have a comprehensive eye exam, because there are some issues that might be happening in your eyes and they don't tell you, but they are just happening in there. So please, at least once in a year, make sure you have a thorough eye examination, a thorough dilated eye examination, so you will be sure your eyes are intact. Then another thing we should do is we should try to make sure we know our family eye health history, because there are some conditions, a lot of conditions that damages the eye that runs in the family line. So it's good you know your family eye health history. Know if your family if there's anybody in your family that has glaucoma, that has cataract, so that when you meet your eye care practitioner, you give them those history, and those history guide them in how they pay attention to details more while checking your eyes. Then when you are having to do any job that could be dangerous to your eyes, you work with chemicals, you work with hard materials that could hit your eyes, always make sure you wear safety goggles so that your eyes will always be protected. Anything happens, you are sure your eyes are safe. Then another thing, with this our present age, where we use TVs, we use laptops, we are on our phones for us, we have gadgets. It's good, like if you see what I'm wearing now, I'm wearing a blue cut transition lens. It's good you wear spectacles that could help shield undue light to your eyes. The recent age, before now, we're used to photochromic lenses. Now we are used to blue cut because they have the ability to cut off undue rays from getting into our eyes. Because truly, when undue rays consistently hit at the back of our eyes, we could have burns, we could have retinal issues, we could have our eyes begin to deteriorate. And like we started, age tells on our eyes, but these are some things we can do to limit the way age is telling on our eyes. Do you know that wearing your blue cut lenses on your eyes regularly could actually slow the pace of an eye that should develop cataract as much as possible? So this wearing safety goggles, wearing your blue cut lenses on your eyes can help protect your eyes. Like I earlier said, avoid smoking, avoid taking alcohol. These things are not, they are not safe for your eyes. They are not safe for your health. Also, another thing we could do is make sure you rest your eyes duly, especially if you are the type that sits before the system for long. We have this rule, 20-20-20 rule. While you are watching your TV, you are watching your phone, you are on your phone, you are on your laptop for long. While you are on the laptop, if you have stayed on your system or any gadget for 20 minutes, take the next 20 minutes, take your eyes off and you bring your eyes back after some minutes. So in that way, you are relaxing the eyes. So you don't just use the eyes consistently for a very long time. You get the eyes fatigue, and that is not very good for your eyes. Practice safety in your workplace. Please make sure you are very careful with your eyes. Don't play with your eyes with anybody. Don't play with your eyes with anything, because anything gets the eyes damaged, you might not be able to recover them. Don't use someone else's eye drops. Please don't.
Thank you so
Make
much for
sure your
that.
eye drops are given to you
Yeah,
by
so
doctor.
how can we heal our eyesight naturally in terms of what we eat?
How you do it naturally? Like I earlier said, eat diets that are good. Eat balanced diets. Take a lot of vegetables. Take a lot of vegetables, because vegetables have vitamins and minerals and antioxidants that help the eyes. That's these antioxidants, these supplements we give in form of drugs. If we take good vegetables and we take fruits regularly, when I say vegetables, it's not vegetables we have overcooked. Vegetables that you cook lightly, so that the nutrients you want from them, they are still there. If we take these things, we might need just a little or none of those supplements we take. So if we should take vegetables, we should take fruits regularly. And when I say fruits, it doesn't necessarily have to be just apple. Fruits generally, carrots, strawberries, your apples, your cucumbers, your watermelon. Take fruits generally in their seasons. They help the eyes. They help the eyes very well.
Okay,
So
thank
that's
you
the
so much.
natural way I think to help
Yes.
our.
Okay. Any additional tips to prevent vision loss, like losing it totally?
Losing it totally, how to prevent it? Be the friend of your eye doctor. Be a friend to your eye doctor. Please don't take anything, don't see anything that happened to your eyes as too little to call on your doctor. Don't see anything as too little to call on your eye doctor. I would round up with this. I saw a patient some months ago. At that time, the woman came, that was in July. The woman could still see. Her vision was good. She was placed on medications. She was told to get her spectacles, but she wasn't serious with them. At the time she came to get her glasses and to get her medications, it was about 3-4 months later. As at that time, she was helped into the clinic because she had lost her eyes. So just be as close as you can be to your eye care practitioner. Don't see anything as too little for you to call on an eye doctor to check. Don't patronize quacks. Don't self-medicate so that you can save your eyes and keep them. Especially as we age, take good care of them. They are God's gifts.
Thank you so much, Dr. Bouquet. It's been wonderful having you. Thank you for that. And to you out there, thank you for being part of the show. I hope you've learned a lesson. You now know how to maintain a good eye hygiene, and you know that having to take seriously your eye is very, very important. So be a friend to your optometrist. If you don't have any yet, please look for one. Until next time, when I come your way again with another exciting topic, I remain Oluwaseun. Goodbye for now.